Welcome to Mindset and Muscles with Amanda. I am your host, Amanda Ferlisi. Welcome back. Welcome if this is your first time. I'm very excited for this series. We're going to be doing a physical therapy series talking about the benefits of physical therapy in personal training, and just learning about the body from a physical therapy professional. So I did want to introduce one of my favorite physical therapists, Garrett Labberton. Am I saying that right?
Yep.
Perfect. So Garrett, if you could please introduce yourself, that would be great.
Of course. Well, thanks for having me. Like Amanda said, my name is Garrett Labberton. I'm a physical therapist in Wellesley, Massachusetts at a clinic called Divergence Physical Therapy and Wellness. Got into physical therapy kind of a long time ago. I was an athlete growing up, ran the gamut of all the sports I played, and got myself injured a number of times. And the physical therapist I went to was also an athlete. He had played football in college. So, there was obviously some type of legitimacy in my head of what he had to say. And then when we started talking, very knowledgeable, very into the ins and outs of treatment as well as training. And I just my interest was piqued, just how rehab and performance kind of go hand in hand. So I went through the kinesiology program at the University of San Francisco for my undergrad. I'm originally from California, so I stayed close to home for undergraduate work, and then came out to New York and went to Columbia for my PT program, and then settled in Boston with my wife in 2016. So the journey of PT, the way that's kind of gone for me is in graduate school. I had a couple classmates that were kind of ahead of the game, and they're doing really well for themselves with their practice in New York. But they found a company or a philosophy with PRI, which is the Postural Restoration Institute. And it's kind of a hot topic or a polarizing topic in the PT world. But at the time, I listened to what they had to say, and I, quite frankly, was more worried about passing all my tests and getting everything done than I was about jumping down the rabbit hole. So once I finished PT school, started looking up these guys and the PRI stuff, and really just kind of started following treatment down that path. And the path is really about respecting the asymmetries of the human body. The goal is not about creating symmetry, but enhancing movement options. So that's kind of where I have been going with my treatment. And I'm at a facility now where all of us are involved in the PRI studies. We have a certified practitioner here, and there will likely be more. I'm planning on sitting for the certification next year, but I'm sure we'll get more into the actual philosophy. But that's kind of been my journey to this point within PT.
Awesome. So I did also want to give a little background as to how I met Garrett. Because he is so great. He helped me a lot with a lot of issues that I had going on. I have a huge trust problem. I think everyone kind of does. And Garrett's really good with like just listening to what's going on, addressing the issue. And he always made me feel like very comfortable and explained why he was doing the things that he was doing, which really helped me in with my own body, my problems, as well as with my clients. So we met when we both worked in the Back Bay in Boston, and I was a personal trainer in the Back Bay before the world, shit the bed. And then Garrett worked in Joint Ventures, which was right next door in physical therapy. So, we created this really great working relationship where if I had a question, he'd help me. I referred clients to him, and we just saw like a huge benefit between, collaborating together as a physical therapist and a personal trainer, as well as like sifting in all of my clients, because I had clients that had like little issues or issues with their hips, their knees, their shoulders, whatever it was. So it was really great to see the aspect of how he helped people, because, as a personal trainer, our knowledge is like to hear, and then physical therapy is just so much more in depth with the body. And in my experience, it's really great to bring someone in that really knows about the body. So obviously a physical therapist, and like working together to solve the issues that your client has, because most people, their body, like even myself still, you're not perfect, you're not symmetrical, and we all have issues. So working with someone that knows how the body moves to that level is just super beneficial. So Garrett helped me progress professionally as well as help my clients work better with their own bodies. So thanks, Garrett. You're a huge help.
Of course.
So I did on my Instagram post some questions, and I will say that the number one question that I got, I could have screenshotted all of them. I think there was like 20 something responses, and I want to say maybe 18 had to do with sciatic pain. Now, um, Garrett's going to explain, but because he doesn't know you guys personally, he can only speak like a little bit more vague, I guess. So one of the questions was, what can help with sciatic pain, tailbone pain, and hip pain? I always stretch, but it always hurts. So Garrett, you can obviously answer it how you want, but again, sciatic pain, number one. So take it away.
I mean, that in of itself is a loaded diagnosis. I think the first thing to be aware of with sciatic pain is that is a very easy diagnosis to be given. Any type of nerve discomfort in the lower body can be coined sciatica. But the sciatic nerve itself is a very, very big nerve. It originates, I'm going to blow my anatomy right now, but it's I want to say throughout most of the lumbar spine and the sacral spine, that nerve comes out from the spinal column, condenses down to a single cable of a nerve, and then travels into the hip, kind of right through the back of the hip muscle, which is where people hear about their piriformis. Mm-hmm. And then it branches off into a bunch of other muscles or a bunch of other branches within that nerve, all with different innervations, all with different distributions, both sensory and motor. And I think the term sciatica doesn't really provide that much information in terms of where that structure can be impacted. Mm-hmm. It also doesn't provide information on how that structure is being impacted. And just anecdotally, I can say that people have come in with a diagnosis of sciatica that has eventually not been sciatica. So it's a very common diagnosis, but I think it ties in a lot with the tailbone and hip pain within that question, but I'll try and separate the answers. Mm-hmm. So I guess it is challenging to kind of talk through this broad topic, but the sciatic nerve can be impacted in a number of different ways. You can have a compression at the spine just based on the spinal position. Mm-hmm. As that nerve comes out the back of the spine, you'll have the spinous processes here, and in between where my fingers are, that's where the nerve would travel out. If there is no room on either side, that nerve can be pinched, which could then result in some of that radiating pain. Another option is musculature surrounding that nerve could be too tight, or there could be connective tissue that is impacting that nerve. And once that nerve is impacted, the inflammatory response is really what's going to be driving that pain. And with a nerve, that inflammatory response is not as clear cut as a bruise. It could stick around a little bit longer than a bruise could. The threshold to pain decreases, so less of a stimulus is going to result in that pain. And then it just becomes exhausting to deal with pain, and you start dealing with the fear of movement and the fear of pain, which is its own beast as well. So all of that could contribute to the sciatic pain. I think the challenge in treating it is twofold. One, it's, as you said, when you and I work together, it's being able to communicate and discuss what's going on. And in some cases, clients will come in and, they won't, when you get to the meat of it, they won't be in that much pain, but it's really how fearful they are of movement and fearful they are of further pain that is actually the limiting factor. Mm-hmm. That treatment looks very different than someone coming in with acute pain. So just very generally speaking, my personal treatment method for sciatica is, everyone's heard about the core. Everyone's heard about strengthening the hips. But I,
Actually, can you talk about the issues with the core in relation to sciatic? Because I know you could go on like 17 different tangents because I know it's such a broad topic, but most people don't activate their core. And that's the number one issue that I have with clients. And that's something that you and I have worked on specifically because even myself, I have issues with that, like everyone. So can you explain the like how to activate the core, I guess, or the relation between core activation and sciatic?
yeah. So the core is an umbrella term to describe a group of musculature. That group of musculature will control a number of different regions of which the sciatic nerve is a part. It's going to control the rib cage, it's going to control the pelvis. And between those two structures, you can gain stability through the spinal column and the nerve area, and impact how muscles are firing. And this is where people will get into the whole stretch, don't stretch problem, which is probably a good thing to talk about as well. But the way I train the core is with a lot of breath work. So it's a lot of breathing. A big component is a full exhalation. So if I were laying on my back with my knees bent, I would inhale through the nose and exhale through my mouth like I'm trying to fog up glass. So, but I would do that completely to get every bit of air out of my lungs, which would result in my rib cage internally rotating and depressing, which would result or be a result of my obliques activating. If my obliques activate and my rib cage comes down, the next logical step for your body to take is for your pelvis to tip up or to posteriorly tip. That result is going to be in a more stable position with the rib cage and the pelvis on top of each other, and you're activating the musculature that is going to be most beneficial and most efficient to A, reduce pain, but B, also produce movement. So anytime somebody, I won't say anytime, I won't do any broad statements like that, but the majority of the time people come in with back pain, my first move is to have them in that position, fully exhaling so that they can feel that is a relatively neutral position. The rib cage is down, the tailbone's underneath them, and the resulting musculature that is activated is going to A, directly counter the tight low back that everyone complains of, the tight hip flexors that everyone complains of, and it's going to activate the musculature that you are going to want to use to move, to complete squats, lunges, deadlifts, all the stuff that we're trying to build you back up to, or if it's a personal training client, you're trying to progressively load. That is the combination of musculature that is going to be most efficient. So the training sequence, at least initially, is that full inhalation through the nose, the full exhalation through the mouth, and then you hold that exhaled state for 5 seconds. And without letting go of the tension that you've developed, you inhale again. So it should feel weird. People are going to say like they can't get a full breath in, it's not comfortable. But that exhaled state is going to help inhibit the overly active muscles.
So sorry to interrupt, but so would you suggest anyone that may think that they have a sciatic pain to do that and see how they feel after they perform that? Is that something that you would do?
You're not going to hurt yourself doing that.
Right.
So I think that's a safe thing to attempt. And similar to the question that you brought up is something that we hear a lot, but that repeated stretching might feel good short term, but it doesn't result in any long lasting. And depending on what you're stretching, you probably shouldn't be stretching that. I don't want to say that globally either, but a lot of times when I talk to people, they've been stretching their hamstrings when they shouldn't be stretching their hamstrings, or stretching their hip flexors and quads without taking or without addressing some of the variables that makes that stretch more effective. So I think, to me, this technique or this position in this exercise is you're not going to lose out on it. It's either going to feel better and you're going to get the hang of it, or it's not going to feel better and then you're going to be looking for answers again, and you can either look to you or my information will be provided as well at the end of this podcast. But you can DM me or we can get you on the schedule as well if there are issues with that. But I would try this before I would try stretching my hamstrings.
Perfect. And then I did have a question about, so what what are the symptoms of sciatic pain? Because I know that I've had these issues and a lot of people, it's just so common. So is there like a clear cut like symptoms for it so people can obviously we don't want people to diagnose themselves, ever do that. It's always good to seek a professional, specifically a physical therapist, right? So what would you say are the top symptoms that people could look for to see oh, maybe this is it, or maybe it's this, or whatever it is?
Well, I would almost say that it'd be more valuable to try and figure out, or not figure out, but to determine what the generator of the pain is, because the different structures, if they're impacted, will present differently with pain. Nerve pain is typically a pulling sensation. It almost feels like your skin is being pulled.
It's
And that
comfortable.
it's not fantastic. But that could travel from the low back all the way down to the back of the calf or the ankle. So if there's any type of pain that is like almost a superficial pulling, it doesn't feel like a muscle is being pulled. It feels like a very intense pulling pain running down the back of your leg. That would lead me to think it would be more of a nerve impingement or a nerve that's impacted.
Mhm.
Another region or another structure in that area that you could feel discomfort at is hamstrings tendinopathy, which is pretty common. But the hamstrings attach at the sit bone, so they attach way up the back of the leg.
Mhm.
And at the sit bone itself, there could be some stress at the tissue. So you'll get some type of tendinitis or tendinosis type changes,
Mhm.
which could result in the same location as pain, but not the same presentation as pain. We see that a lot, I would say, with a lot of females, younger females as well. But anytime anybody stands with their hips tipped forward, so they're sticking their butt out and they're sticking their chest up, that's going to stretch the hamstrings,
Mhm.
just positionally. So
Mhm.
you could get some tendinotic type changes at that attachment, which could potentially be confused with sciatic pain. Um, and then everyone knows about all the musculature in the hips, right? Everyone's heard about piriformis. Everyone's been told that the sciatic runs right through the piriformis, or it has a chance to.
Mhm.
Um, in my experience, again, this is purely anecdotally, I would, a lot of times the discomfort in there, even if it is sciatic, or even if it is sciatic in nature, is secondary to a positioning of the pelvis.
Can
So
you
it's not
explain
necessarily,
where, so a lot of people don't, you and I know where the piriformis is. Can you explain that? Because that's a huge issue that I've seen in my clients. I also have those, I mean, I have all the issues, right? I always say, but can you explain where the piriformis is in relation to where the sciatic nerve would run? And then I also want you to mention the TFL, which is also a lot of issues with that and stuff.
yeah,
Yeah, we're going
yeah.
down that rabbit hole of that. Because this is the honestly just oh, as I punch my microphone, this is honestly one of the most common issues that I have with my clients currently and in the past when you and I were meeting all the time.
Yeah. And I would say, both the structures that you just described are kind of two sides of the same coin.
Mm-hmm.
Both are impacted by pelvic positioning. Um, both can be diagnosed as an isolated issue,
Mm-hmm.
when in reality, addressing something away from the pain is actually going to result in reduced pain. So the piriformis runs underneath the glutes. So if you have your hips, the piriformis is underneath the glutes, and
Mm-hmm.
its job is to externally rotate the femur. As a secondary external rotator, it's not supposed to be the primary external rotator. The sciatic nerve, as it runs from the back, if you picture the nerve coming out of the back and running down behind the back of both legs,
Mm-hmm.
comes in close proximity to that piriformis. And there's a certain percentage within the population that actually runs through the piriformis. It's a low percentage, but there is a percentage of people where the sciatic nerve runs through the piriformis. And piriformis syndrome is theoretically when that piriformis can be overactive for a number of reasons, if the glutes are weak, or if you've exceeded your capacity for movement, that piriformis can be weak and cause pain, which can also contribute to sciatic pain. because of the position of the piriformis in relation to both the hip and the leg bone, any type of alteration in normal position of the pelvis, hip, and leg bone can result in the piriformis not feeling quite right.
Mhm.
So the piriformis itself is not the issue, the position is the issue. And we can get into like some concepts with that as well,
Mhm.
in terms of side to side differences. But the TFL kind of falls into the same category. The TFL sits in front of the hip joint, and it's a small muscle that attaches all the way up, kind of below, right below where your hip bone is, and then
Mhm.
turns into the IT band. So it actually tapers down into the IT band, which then attaches below the knee. So the IT band itself is not contractile tissue. It, it, I haven't seen research that says it can be stretched. And, you know, a lot of people foam roll their IT bands. And I think as long as the goal of foam rolling the IT band is not to lengthen the IT band,
Right.
that's fine. I think there will be short-term benefits. You might get some extra blood flow, increase the temperature to the tissues, which would be good prior to working out. But you're not stretching the tissue. And if you have IT band pain or IT band syndrome, typically I will look up at the TFL and then again at the position of the pelvis and the hips.
Would that also be related? So if you're having an issue, because obviously I just had a couple people run the marathon and their IT bands are really tight. Would that also have to do? Because I noticed that they had really tight glute mediuses. Would that have some relation to the IT band?
Yeah, so I mean, we'll just talk about the population you just described. So with
Okay.
runners, especially marathon runners, it's a lot of impact. It's a lot of
Yeah.
volume, over a relatively short amount of time, even though it is like 4 to 6 hours. Like it's a lot of impact and a lot of volume for the body to be able to take.
Right.
And if the hamstrings, the glutes, and the obliques, how we talked about with the low back, if those aren't able to handle that amount of stress, the TFL will kick in to try and drive the leg, continue driving that forward movement. Again, that muscle it's a smaller muscle. It's designed to move the leg, but it's not designed to be a prime mover of the leg, especially not in the motions of running.
Mhm.
So that it becomes overactive, overworked, and that dysfunction travels down to the IT band. So you could have those tight glute meads, and have those glute meads not firing appropriately.
Mhm.
You could have tight TFL and have that TFL not firing appropriately, and all of those things could result in the pain. The treatment of that would be surrounding assessing how the pelvis is positioned in space, how the person is able to move from side to side as they run, and then treating those movement pattern deficits and then gradually loading them to the point that they can tolerate the stress they want to put themselves under. Does that make sense? Did I say that
It makes
clearly?
it makes sense to me. I just think we need to I'm
Yeah,
pretty sure people will understand, but basically the topics that we're talking about, there's so many muscles and movement
yeah,
patterns involved that giving like a direct answer to some of these questions is tough in general. So I think we
yeah.
almost would have to like take like what's the word for it when you have like a clinical case or something, like I'd have to give you an
Case
example of
study.
it. Yeah, a
Yeah,
case study. I'd have to give you a case study to break it down just to be more specific, but everything you're saying makes complete sense because basically when there's one thing wrong and you always tell me, okay, this might hurt, but that doesn't mean that's where the problem is coming from. So knowing, obviously seeing physical therapists and being treated, but knowing that wherever you're having the pain doesn't necessarily mean where the pain's coming from. And then especially with the TFL, a lot of people don't know what that is. I have always have TFL pain, and that also has to do with the position of my hips and how I'm structured as a person. Um, so I think we're probably going to end up doing a whole other segment on sciatic pain and do a case study about it because it's just so involved and so many people have that issue. But I did
yeah.
have another question. Nope, it's on this phone. Two phones, you know what they say about people with two phones. So a lot of knee pains. A sciatic pain was number one, knee pain was number two. So how can I work out without having pain above my knee and sometimes aching in my knee. Now I know that we could go, I know you could probably say that's so many different things, but that was a common question. So knee pain while working out. My assumption would be like probably squats, probably deadlifts, or just bending it in general. So maybe talk about what knee pain is, what could be causing it, maybe along those lines.
Okay. So again, generally speaking, I think for the purposes of this conversation, we'll rule out any type of structural issue. So
Okay.
I won't talk about meniscus. I'll talk more about kind of the pain with movement, the pain with bending and loaded squatting,
Mm-hmm.
or loaded movement. And I think probably going to be annoying, but the conversation is going to talk right back up to what we were just talking about. So
But I think it's great that you're pointing that out because a lot of people don't realize that everything is so intertwined and your movement is so important and it causes all these issues. So I think it's really important that you have to keep going back to the original issues and stuff.
yeah, so I think a lot of times with knee pain with exercise or knee pain with movement, the mechanics potentially from the ankle up to the hip and at the spine and at the rib cage, somewhere in there something's not quite right. So I think looking at the way somebody moves is very important. Some people hyperextend their knees and they just fly into extension. You'll see that knee kind of overextend back, which is going to indicate, yeah, which is going to indicate one type of weakness. Other people posturally are very much like we discussed earlier. The chest is up, the butt
Like
is
me.
out,
That's
like
fine.
you. And I think, that position in of itself is not going to allow for the hamstrings and the glutes to do their job. So when you're walking or squatting, you're going to be leaving out kind of the engine of movement, which over time could lead to some knee pain.
Mm-hmm.
Um, you can also look at the IT band syndrome that we were just talking about can contribute to knee pain.
Mm-hmm.
You can have some patellofemoral type issues, which is the kneecap in relation to the leg, the bone of the leg, and how those sit. So a lot of times with knee pain, I go right back up to the hip. And it's strengthening the hamstrings, it's strengthening the glutes, it's strengthening the obliques and the core. And then with knee pain, it's programming exercises so that they are getting the increase, the client is getting an increased load, getting an increased training stimulus, but in a way that is not at the threshold of pain. And then gradually increasing that stimulus while controlling their pain and controlling their movement patterns to the point where they're able to train without pain. And then it's right back to the personal trainer to more really get after the loading.
Mm-hmm.
But if, again, don't want to give like
Right. No.
global rules,
So
but
disclaimer, don't take this as like these are facts. You're just making assumptions based off of like thin air. Essentially you
yeah,
have pain in your knee. These could be some of the things.
yeah. So again, I typically, I cannot say I've given a hamstring stretch to somebody with knee pain in a long time. I can't say I've given a hip flexor stretch to somebody with pain in their knee in a long time. Most of the time I try and attack it by repositioning the pelvis and the ribs and then training the hamstring and the glutes. And I would say the vast majority of the time it clears up the knee and we get right back to doing the squats or the deadlifts or programming things in a way that is trying to get them stronger and trying to help them perform at their most efficient performance as quickly as they can. So, I think it might be beneficial to talk about stretching versus not stretching. That seems to keep coming up, but that's I normally go with position and strength over stretching for knee pain.
Okay. Now I actually just thought of a question because 3 clients of mine right now are having this issue. And I've also had this issue of not feeling the muscle right. So I'll give you an example. I have a client who actually 2 clients not feeling their back muscles when they're performing a pulling motion. So I'll give this specific example. So during a lat pull down, they're not feeling anything in their back. However, they're just feeling it right here in their front delt and then down their bicep. And then it also is turning into like down in here. So like their tendon. So can you explain why someone like in that situation, why that person isn't feeling their back muscles?
Yeah, I mean, that's a great question. It's kind of it's a concept that travels through a lot of movements outside of just like a lat pull down.
Mm-hmm.
If, again, I'm going to be a broken record, but if the back is up or the chest is up and
Mm-hmm.
the back and the ribs are up and your pelvis is not underneath you, you are going to tie in a bunch of different muscles just positionally to try and get the arm down to the side.
Mm-hmm.
What you could end up potentially doing as compensation is tipping the shoulder forward and then trying to essentially bicep curl that weight in,
Right.
which could lead to overuse of the bicep. It could strain the front of the shoulder, and you're
Mm-hmm.
just not going to feel your back or your lat.
Mm-hmm.
So I will typically, if somebody's having issues feeling the lat, I will cue them to sit back on their hip bones, give a full exhalation to get the abs on.
Mm-hmm.
And then I make sure that those elbows are coming straight down to the trunk and that the shoulders are not tipping forward. Because once you tip forward, that's going to kind of lead to that anterior pain and put the biceps in a position that it's trying to work.
And back to the point, keeping your core engaged and tight throughout that movement is crucial because a lot of people, I'll watch my clients. It's almost like how you would do to me. It's like poke me in my core to make sure it's not turning off. Because sometimes we don't realize that our muscles aren't engaged. We don't
Yeah.
notice like that we at the bottom of a squat, which was my issue, I would let go of my lower abdomen. And the same thing with the lat pull down is keeping that core nice and tight is huge. So can you like go to the side and show what you meant the same way, just from the side so people can see what you're talking about when you're pulling?
Yeah. So if my chest cannot come down,
Mm-hmm.
if I can't get my ribs down and I can't get my abs on, and I like to hang out up here, when I'm
Yes.
going into a pull down, my shoulder could potentially drop forward. My shoulder blade could come up on that rib cage. And then when I try and pull my elbow back, my lat is not doing a whole lot
Right.
because that movement is not dependent on the lat.
Right.
The movement is going to put stress through the front of the shoulder, and it's going to ask the bicep to essentially bicep curl that pull down
Mm-hmm.
towards your shoulder. You've turned it into a weirdly positioned bicep exercise. So training that is making sure that you get that exhaled position, you're sitting on your sit bones, and you keep those shoulder blades flush on the rib cage as you come down, and make sure that there's no elbows popping up,
Mm-hmm.
so that you can make sure that the lats are actually doing what you're asking them to do.
I hope everyone's watching this because this is a pet peeve. Again, this is why like you should see yourself in the mirror and see like your form. I check myself all the time. I'm not perfect. Or take a video of yourself. Um, so my question about that specific movement. So you just showed how to correct it. Now say now again, I've corrected my clients to do it that way. Now, what happens if they say that they can't feel it in their lats still while engaging the core and in that movement? What would you then say is the issue?
I mean, it could potentially be an exercise prescription issue.
Mm-hmm.
So if they can't do a traditional lat pull down with the
Mm-hmm.
bar, you could have them half kneeling with a cable
And pull
off
that
to the
way.
side and pull down this way. That might be
Okay.
a little bit easier for them to feel the engagement.
Okay.
And if you're really trying to get after lats, like deadlifts are a great way to get after lats if they can
Mm-hmm.
do that right. That's a complex movement for sure.
Mm-hmm.
But if you're trying to get volume through the lats, you can use that. Or a chest supported row is a great pulling exercise. So I think it's more just kind of like playing around with different movements to make sure that if they're in the right position and they feel that lat fire more in one position than the other, like there's no right or wrong.
Right. It's just
So
moving them different, just like
yeah,
anything. Okay, so let's take a look at another question because if not, I have another question. Again, a lot of them were sciatic pain and knee pain. Um, okay. What so basically the question is kind of worded weird, but during a squat, they're not feeling their glutes. What so I'm going to assume, we'll say it's a barbell squat just as reference. So they're barbell squatting and they're not feeling their glutes. They're only feeling it in their quads. What would you say is the issue there and how to adjust it, fix it? Any suggestions with that, which is also common?
I mean, I think a pure squat is the hips going straight down to the ankles, or the pelvis going straight down to the ankles and straight up.
Mhm.
The knees have to come forward. The sacrum is doing very specific things that, you know, we don't necessarily need to get into, but that it's not an easy movement. It's also something that there's a lot of information out there that is not always the most beneficial.
Mhm.
Because depending on your size and actually the position of a squat, like your knees can come close to the edge, if not go over your toes. My knees definitely go over my toes just with how tall I am. So you're gonna feel your quads. Feeling the glutes, that could be something as simple as just elevating your heels a little bit to let the knees go forward, to let the knees get out of the way and let those hips go down straight. Elevating the heels does more than just cleans up your ankle range of motion. It's actually easier for you to maintain rib cage position with your heels elevated.
Mhm.
And maintaining rib cage position is going to be very important to getting the glutes to fire. Because as a broken record, if your chest is up and your back, you're in this position and then your hips are dumping forward, your hip flexors are tight, your low back is tight, and the glutes are stuck in the middle, not able to function appropriately.
Mhm.
So I think while a squat is a complex movement, you can take away some of the difficulty just by lifting up the heels or doing a goblet squat and bringing the elbows forward and pushing the mid back away like this.
Mhm.
And I think just building up through that progression before a barbell back squat, which is a complicated movement, but it's also physically demanding to keep the position that you want to keep with the barbell on your back.
Right. So you would suggest elevate. So use like plates to put under your heels, just for anyone that doesn't know what that means. So like plates below, underneath the heels, elevate that. I know I used to have to do that a lot. And start with a goblet squat holding in the front. Um, I feel like you and I should do just like corrective exercises or like not in this segment, but like showing how to do a squat, showing how to do a deadlift properly so people can understand because I know you're new to Instagram because I've been bugging Garrett for like 3 years. Just get on Instagram and show people how to do things properly, and he just wouldn't do it. And then all of a sudden he's like, "Hey, I have one." I'm like, "Whoa, welcome to the world."
One of the young guys at work had me, set me up, and I feel like I'm 1,000 years old every time I try and post something, but I'm
So
getting
he
the
just
hang of
did it.
it,
He
I
he
think.
ripped the Band-Aid off for you and just did it.
Oh yeah, Band-Aid
Good.
was ripped off.
That's a good guy. So I think we should do like segments of like what works or like, I mean, how to do a squat, how to do a deadlift, because the information now that you can see all the Instagrams is just terrible. So I think that'd be really good. And so I did want to ask another question. What would you say? This is probably one of the last questions, but if someone's having issues with with doing any abdominal work, they're only feeling it in their hip flexors. I know that's also really common. So can you explain like what may be causing that and how to fix that or something along those lines?
So the hip flexors are very commonly kicked in with that, and it's something that we have to cue out of. The primary or the initial correction would be just making sure you're getting a pelvic tilt.
Mhm.
It's just making sure that you're flattening that low back against the floor or the ground, whatever you're lying on. That tailbone should be coming underneath you and the ribs should be coming on top. In that position, your hip, your hip flexors can't fire, or they can't fire in a way that would take away from the exercise. So you're just taking them out of the equation positionally and then allowing yourself to train from there. I actually just did a couple posts about that. So if anyone has any questions, there are a couple posts on my page that that are about how to position your pelvis and how to activate the hamstrings and everything to reduce the hip flexor engagement.
I think that's huge because a lot of people, if you're not engaging your lower abs, your hip flexors just kick in, especially if you're someone who sits a lot, you're just super tight. So, well, obviously, I'll have your I'm so happy you have an Instagram. Have your Instagram posted so people can take a look. Um, all right. So that was all the questions that I had. Do you have anything that you want to add to it? Because I know we're going to be doing this. My goal for both of us is to do it at least once a month, bring some great content to everyone and how important it is. If you're a physical therapist out there, you should partner with a personal trainer and vice versa. I've learned so much just from Garrett alone because he's very like literally I've had all the issues, so when he breaks it down for me it's very easy for me to understand. But if you are a personal trainer, you should always partner with a physical therapist for all issues, whether it's a minor pain or someone having, a hip surgery or knee surgery, because it's always good to get the feedback from a physical therapist, especially when programming. So, Garrett, do you have anything you want to add to this?
I would just kind of second your your sentiment about having a good relationship, personal trainer versus physical therapist, or with a physical therapist and personal trainer. There are a number out here in here in Wellesley that I think we've really worked hard to try and show that what we are doing is at the very least complementary,
Hmm.
if not allowing their clients to work better with them, whether it be truly personal training one-on-one, whether it be small groups or boutique fitness.
Hmm.
A lot of the people that we have come in are were previously just exercising in pain, and once we were able to reduce their pain and improve their confidence in movement, they were able to go back to their exercise routine and their personal trainers and see them more frequently, or see, hit PRs or move better. And I think that that type of symbiotic relationship is very valuable to both parties. So um, I would just agree with what you had to say about that. And I think that this type of this type of conversation, I think, could go any way that you and whoever asks questions would like it to go. I mean, I'm happy to get as clinical as I can and talk
Hmm.
about a treatment model or a treatment philosophy, and I'm also happy to kind of keep things general and kind of just um, talk through some of the questions. But if anyone does have any specific questions, like, they should feel free to reach out to me. Feel free to look up our facility page as well as mine, because we're always happy to answer questions.
I did want to point out, you said you don't have to work out in pain. It's not normal. A lot of people actually normalize that. So you shouldn't be in pain when you're working out. You should feel like the burn of the exercise. But if you are having any issues, reach out. Um, I always suggest Garrett, if you are in the Wellesley area, if you're in Massachusetts, he is my favorite and just like the most informative physical therapist I've had. So, and then again, just really want to reiterate, if you're a personal trainer, if you never reached out to a physical therapist, especially for a client that has pains or issues, you're really doing your client a disservice because you're not able to really help them fully, in my professional opinion. So, Garrett, I really want to thank you for being on. We're going to continue this series. So thank you so much for being on the first episode of our physical therapy series. And we will both see you guys soon. Thank you for listening. Make sure you share this on your Instagram, Garrett, and share it on all the things. So thank you guys for listening, and we will see you in the next episode. Thank you guys.